You will find that you have so much to learn over the next few weeks. Your life has just changed beyond measure. Although you may doubt yourself from time to time, you will find that a lot of what you think you don't know will come naturally.
If we have any other questions, is there a number that we can call, or can we contact you personally?
Your nurse will give you the phone numbers to call if you have questions once you get home. Have these numbers close by and in a safe place for easy access. There is no doubt that you will have questions, so when you think of something, write it down and ask or call your healthcare team. Remember, this is a time of transition and growth.
So one of the things we encourage here at the hospital is rooming in.
In the days following birth, you and your baby's physical and emotional need for each other continues. With rooming in, you get to know one another as attachment and bonding grow strong. As a new mother, you will quickly learn your baby's needs and how best to care for, soothe, and comfort your child. Normal newborn care in the hospital can all be done while rooming in. You can be close to your baby and even help with some of the care if you wish. This helps you to feel more confident as you go home.
So that's one of the things we encourage here at the hospitals is rooming in, to understand your baby and to start promoting that bonding. Okay.
Did you ever think that this little person would or could change you on so many different levels? You just met this little one, yet you have a rush of feelings that may overwhelm both you and your partner. It may be instant love, but it doesn't happen to every mom or partner. For some parents, it is a slow and gradual process. You and your partner will have a multitude of emotions from minute to hour to day to week.
The first time you see a child, it's, you definitely have that sense of that unique feeling of, wow, I was helped create this, even though a smaller portion of the creating part, but still, this is part of me, and you definitely feel a special connection with that child. But it took me a little longer to say that I absolutely fell in love with her. It wasn't like love at first sight. I did love my child, but it's finding out her unique personality that later for me is what I love about her. And so it took some time to find that love for me personally.
The transition into parenthood affects you on every possible level: physically, socially, emotionally, and financially.
One important thing I also talk about doesn't necessarily have to do with Elizabeth. It's about the two of y'all. And having a baby, it's very difficult at home. It's hard to get any rest. Baby's up every couple, 2-3 hours, or even sooner than that. And so I usually kind of advise folks to really try and take advantage of help at home, family, relatives, to come over to watch Elizabeth for a little while, maybe even do a feeding, so the two of y'all can get some rest and even some time together. Long term, that'll certainly help Elizabeth out.
Okay. That sounds great.
As you recover from the initial shock of a premature birth, or the birth of a baby who needs specialized care in the neonatal intensive care unit, you may find yourself experiencing an onslaught of emotions. These may include guilt, displaced anger, grief, or jealousy.
She was so small. She only weighed 5 pounds and 2 ounces. And, I couldn't, because of the epidural, I couldn't get up to go walk over and see her, and that was kind of hard. And the baby's doctor came in and said a bunch of stuff I couldn't even understand, and said, "We got to take your baby to ICU." And I was like, okay, what did I do wrong? And I thought I did something wrong. I thought I wasn't breastfeeding her enough. I thought maybe there was too many people coming in to see her.
I felt uncomfortable not having my own firstborn daughter not with me in the room, but at the same time I felt a little relief, because if we would have took her home with this condition, and it could have got a lot worse. We're still here 3 days after the date that we were supposed to leave.
For more than a week now,
and
it's really hard.
Now we have to wait another 3 more days, and we're just ready to go home. We've got all this stuff prepared for her in her room.
Parents respond to these feelings in different ways. Some openly express their concerns, while others keep their feelings inside. Coping with all these feelings and emotions is often easier with support from others. Be sure to ask about parent support groups and hospital staff members like social workers or counselors who can help.
Taking care of a new baby is a big adventure. There are certain things that we didn't expect to happen. One is lack of sleep. What we've had to do is become a team and be able to rotate shifts in taking care of our child, feeding him early in the morning, late at night, and just being able to cope together as a team to be able to take care of our child.
Just as a new mother has an enormous rush of feelings and emotions, so do dads and partners. You may experience an intense love that is something rare and new. It could be a totally overwhelming feeling. A new sense of responsibility and anxiety may set in at the same time. Your sense of protection of this tiny being, though, is instantaneous. Partners, please know that it is normal if you have feelings of jealousy or a sense of exclusion at times. Everything is revolving around mom and your new baby. It is so important for you to have special time with your new little one, either through diapering, bathing, or just cuddling. This intimacy will allow you a pure sense of closeness, and it will let the baby feel calm and secure in your care. It is a great way of decreasing personal doubts and fears that are so normal for dads and partners.
I love my baby and I love being a father, and that's something that I would love to continue to do.
In the weeks following delivery, the changes of pregnancy are gradually reversed as the body begins to return to its non-pregnant state. The amount of time required for this process varies depending on the type of delivery you had and other associated medical conditions. The first 6 weeks following the birth of your baby is called the postpartum period. The normal changes of the pregnant uterus to accommodate a developing baby are not reversed overnight. During pregnancy, the uterus increases approximately 11 times its non-pregnant weight. After delivery of the placenta, the uterus is about the size of a grapefruit and can be felt just below the umbilicus. It weighs around 2 pounds immediately after delivery. In about 6 weeks, the uterus will return to its normal weight, a mere 2 ounces.
And are you feeling okay? Are you comfortable the way you are? And you can always tell Dad, hey, give me the pillow more up here, and also when she's latching on, when she opens her mouth, you want to bring her head towards your breast and not lean into her, okay? Because you want to be comfortable.
For me to start cramping?
Yes. It's very normal because you're producing a hormone called oxytocin, and that helps a lot with your...
Some women will notice afterbirth pains that feel like menstrual cramps. These cramps are the result of the muscle of the uterus contracting back to its pre-pregnant size. They are beneficial in reducing blood loss following delivery and may be pronounced during breastfeeding. If you have stitches that cause you discomfort, you may soak in the tub or sitz bath for 15 minutes 3 times a day. Apply anesthetic spray or ointment that your healthcare provider has prescribed as needed. Do not douche, use tampons or vaginal suppositories until your healthcare provider has given you the okay. Call your doctor's office when you get home from the hospital to make an appointment to be seen about 6 weeks after delivery. If you had a cesarean birth, remember you're healing from major abdominal surgery as well as from childbirth. Your healthcare provider will want you to take it easy and will provide you with instructions for when you get home.
Your C-section with your incision. Make sure you look at it in the mirror When you take a shower, just let the soap and water run over it and pat dry it. Do not rub it. Also look at it. If it starts to look like a cut that's infected where it's red, puffy, pus, drainage coming out.
Keep your incision clean and dry as instructed by your healthcare team. You may have constipation and gas pains at first. Walking, light exercise, drinking plenty of water, and eating high-fiber vegetables, fruits, and grains will help. Please call if you have a fever or your incision becomes red, swollen, tender, warm to the touch, or if it is draining. The drainage from the birth canal following delivery is called lochia. During the immediate few days after the birth, the discharge is like a menstrual flow. In 3 to 4 days, the discharge becomes more watery and pale. By the second week, lochia is thicker and more yellow in color. Finally, after 4 weeks, the discharge decreases to a minimum as the uterine lining heals.
Okay. Do you have any other questions for me or anything?
Yes, ma'am. I'm having some hemorrhoids. What should I do to take care of that?
Well, hemorrhoids is common, especially when you're pregnant.
Okay.
And pushing can cause them to get aggravated. So one of the things we do is it's called a sitz bath. You can use that a couple times during the day. Make sure that you can go to a drugstore and get yourself Tux pads and use that in the area to relieve some of the soreness.
Showers are usually fine as soon as you can walk after delivery.
And every time you go and use the restroom, urinate, make sure you fill this up with warm water. Okay, not too hot. Make sure you check it with your arm or with your hand, and just open it up, and then just make sure you clean all down the area, okay, and pat dry.
It's no surprise that the most common complaint heard from new mothers is that they feel so tired. There are several reasons for the extreme fatigue following delivery. Women do not sleep well late in pregnancy and are further exhausted by the physical work of labor. Excitement and many visitors further compound the problem. Hospital surroundings and routines, along with the physical discomfort, can make it difficult to rest. Once you are home, make it a point to rest. Sleep when your baby sleeps. You probably will no longer be able to enjoy 8 hours of uninterrupted sleep. Try to look at resting and napping as a priority rather than a luxury. It is so important to sleep when the baby sleeps for the first couple of weeks. Getting enough rest is necessary to give you energy. Feeling tired is normal after giving birth. You are adjusting to new responsibilities at a time when your hormone levels are adjusting from pregnancy to a post-pregnancy state. Ask for what you need.
Hello, how are you doing today?
Great.
I'm the registered dietitian for the hospital, and I just wanted to talk to you a little bit about your diet for where you go home, so you'll have enough energy to take care of your new baby. Especially when you go home, a lot of women try to do immediate weight loss, but we want it to be more gradual. We want to make sure that you're getting enough calories, enough energy, so you're able to take care of your new baby. Even if you are bottle feeding, you don't want to have a dramatic weight loss at one time. About 1 pound a week is what you want to try to do, 6 small meals per day, and then still take your prenatal vitamin, just so that way your body can recover a little bit faster and you have all the vitamins and minerals you need. And same thing with you, Dad, making sure that you're getting enough water, same thing, so having those meals per day so you have enough energy to help out Mom later and change all those new diapers.
Your diet should be balanced and contain the appropriate amount of calories and nutrients in order to fulfill these special needs. Choose food and beverages low in added sugars. Added sugars contribute calories with few, if any, nutrients.
And also for breastfeeding moms, you want to make sure that you're getting extra calories per day. So you're getting enough nutrients to be able to produce breast milk and feed yourself as well. Adding small snacks, 6 small meals a day is a great way to be able to do that. Have peanut butter, nuts, low-fat cheeses are a really great way to be able to sneak in those extra calories to help you get through the day and have enough energy to take care of your new baby.
Every day you will feel stronger and stronger. Your healthcare provider will give you the go-ahead for when you can exercise and may give you simple exercises you can do the first couple of weeks after birth. Very light exercise is a good way to stimulate healing and get you on the road to regaining your pre-pregnant strength. Try to keep good posture while walking, standing, or sitting. This will stretch your muscles and help you feel better. Movement may be difficult at first, but keep trying. The results will be worth it. Notify your healthcare provider immediately if you are experiencing any of the following: bleeding that soaks a pad every hour for 2 hours, foul odor coming from your vagina, fever of 100.4 degrees Fahrenheit or higher, unrelieved incision or abdominal pain, swelling, redness, discharge, or bleeding from your cesarean incision or episiotomy site. Your incision begins to separate. Problems urinating, including inability to urinate, burning while urinating, or extremely dark urine. No bowel movement within 4 days of giving birth. Any type of visual disturbance. Severe headaches, flu-like symptoms, pain or redness in one or both of your breasts, pain, warmth, tenderness, or swelling in your legs, especially the calf area, frequent nausea and vomiting, signs of postpartum depression, chest pain or problems breathing, please call 911. The time has come to start your new adventure as a family. As a new mother, you will feel joy, fear, confusion, exhaustion, and love. The intensity of feelings after having a child cannot be compared to any other life experience. Once you are home from the hospital, you may start feeling sad or weepy. This is what is known as the baby blues. You may encounter impatience or irritability, and even crying for no reason. These feelings generally come and go quickly, but can be hard to understand. It is attributed to a radical shift in hormone levels, physical, mental, and emotional exhaustion, with a combination of sleep deprivation typical of parenting a newborn. However, as many as 1 in 10 women experience emotional symptoms known as postpartum depression. Postpartum depression may start as early as the 2nd or 3rd day after delivery, or take several weeks or months to develop. Many of the symptoms of baby blues are present, but they are more intense. It is so important to realize that these symptoms are not signs of weakness or inadequacy. Postpartum depression is a real condition, and help is available. Please contact your healthcare provider immediately if you think you are depressed.
Baby blues are a very common portion of the postpartum period. What moms need to understand is that this is not an inadequacy of them as a mother. This is just a change in their hormones related to the postpartum period after delivery. This normally only lasts for a few weeks and starts a few days after delivery and ends shortly thereafter. However, on occasion, it does become more severe, and feelings of wanting to hurt your baby or hurt yourself, or feelings of not wanting to be around other people do become involved. We do recommend in those instances that you contact your obstetrician or your primary care provider immediately. There are many things that can be done for postpartum depression to help you enjoy your baby.
How do I know I'm doing a good job for my baby?
You're not alone in feeling a bit insecure with caring for your bundle of joy. Please know that you will make mistakes and stumble from time to time. In no time, you will feel at ease. Trust your instincts. Watching your child grow and become more secure in his surroundings and the world around him will tell you how effective you are in raising your child.
There's this thing right here. What is that for?
That is a device called a bulb syringe.
Okay.
What it's used for is to get baby secretions out of baby's mouth. But it also can be used in the nostrils to remove any mucus if needed. Really, we use it more right now for secretions in the mouth.
Okay.
And the way to use it is by squeezing the bulb and then placing it on the side of baby's cheeks only, never down baby's throat. A lot of times babies will spit up, so they can't wash out their mouth, so this is what you would use it for. This is really good to have in the car seat also, have one in the car seat or in the baby's crib or near the crib, because in case baby spits up any formula or breast milk, you have something right away to remove those secretions. Okay? And to wash it, you just put it under warm water with some soap, and you just squeeze it like this, suck in all the water, shake up the bulb, and then squeeze all the water out and just let it air dry.
Do you all have any other questions about things before we go home?
Yeah, I think we had a few questions. We were wondering about the umbilical cord and the clamp, and how do we care for that once we take the baby home?
It's a good question. Regular care, keeping it clean, waiting for it to fall off. If there's a little bit of discharge there, that's okay. But certainly if you see any redness all around the skin there, that is abnormal, and that could potentially be an infection. So I'd like y'all to give your pediatrician a call if you see that.
And the cord's actually going to fall off in about 2 weeks or so. Sometimes they fall off sooner, sometimes they fall off later, so don't get alarmed.
All right.
Even if the cord is falling off and it's hanging on by a thread of skin, do not pull it, just let it fall off on its own. Once it falls off, it may look a little red and swollen, and that's okay, that's normal. You may have a little blood, but not much. Just keep cleaning it. But if it looks like it's a different color, like blue, black, purple, and it looks really swollen and it smells bad, then you want to call your doctor right away.
We also had a question about the baby feces, and so dark and thick, and is that normal, and how long will it take to transition into normal baby poop?
That's a good question. That initial stool, that dark green stuff, is called meconium. And typically, that meconium will continue to pass, up to 4 or 5 days. The average is about a couple of days. Usually by the time you go home, with feeding, breast milk, and or formula, start to transition to a more kind of yellowy, kind of cottage cheese type stool. But that meconium may persist for another day or so. And that's okay. That's normal.
Right?
Yes. Scared me the first time.
Yeah. And then you just want to do it once.
Just once.
You don't want to keep wiping it and then wiping it again, because you
No.
can introduce bacteria or infection. So you always just do.
Now, do I just want to just wipe once like that?
Yes.
I don't want to get too.
Right, exactly. So do like this, just really once, like that. And then if you need to, you can grab another wipey or another area of the wipe and then wipe again. if you
Okay.
need to. Okay.
All right, listen. It's okay.
Because what happens is when you go down, then you go up again and you're introducing it to bacteria.
If you have a baby boy, also wipe his entire diaper area from front to back with a baby wipe or clean cloth. If he has recently had a circumcision, follow the directions from your pediatrician or health care provider about cleaning the area.
Okay.
So how do we take care of the circumcision when we get home?
It's a good question. I looked at his circumcision this morning. It looks good. Everything is healing pretty nicely. But in those first couple of days after the circumcision, there are a couple of things that I'd like us to do. And one of those is taking petroleum jelly, and we'll give you a couple of tubes of that before you go home. And pretty much every diaper change, what we'll have you do is take some of the petroleum jelly, it's kind of like Vaseline, and basically just kind of smother it all over, the top of his penis there where the circumcision has been done. What that'll do is help protect the skin, allow it to continue to heal without being irritated with the diaper. Do that for a couple, 2 or 3 days, and it should look good thereafter. A couple of things I'd like you to look for is if there's any, we shouldn't have any more bleeding. Okay? So if there's any bleeding, or certainly if anything looks red, or if you see any, kind of discharge from there, those are abnormal things. And I'd like you to either give us a call here or call your pediatrician for a follow-up checkup.
If your son was not circumcised, then do not forcibly retract the foreskin. Only the outside of the foreskin needs to be cleaned during the first year. It should be cleaned and bathed with soap and water, just like the rest of the diaper area. You may be instructed to give your baby a sponge bath until the cord falls off and the area is healed, and if you had a son that was circumcised. Because you want to get your baby clean, dry, and warm as quickly as possible, have all of your supplies and everything ready before you begin the sponge bath. Always test the water, making sure it is not too hot. Remember to always keep a hand on your baby. Never turn your back, even for a moment. Start with the eyes. With a clean corner of a washcloth, wash the inner aspect of the eye to the outer aspect using warm water. Repeat with the other eye, this time using a different corner of the washcloth. Wash your baby's face with clean water. Next, wash around the nose and ears. Never insert a cotton swab up your baby's nose or into the ear. Wash his neck. Then work your way down the front of his body. Make sure to clean between all of the folds of the skin. Be sure to dry your baby thoroughly after each area you wash. Wash your baby's legs. Take the diaper off and clean the baby's genitals. If you have a little girl, make sure you wipe and clean from front to back, so not to introduce infection into the baby's bladder. Turn your baby over. Place him on his belly and wash the back and buttocks. Wrap your baby back up as soon as you can. To wash his hair, swaddle your baby and place him in the football hold. Wash the scalp, making sure to stimulate. Rinse thoroughly and dry. Then, dress him in a clean diaper and clothes.
Hello. Oh, it's looking like he's fussy.
Crying plays an important role. It is your baby's way of talking or communicating with you, as well as a way to release stress and tension. It is how babies express their needs and desires. With that said, knowing all that doesn't make listening to your baby's crying any easier. Let's face it, it can be very stressful, and there may be some days that the crying will be difficult for you to handle. Research has shown that a newborn may spend anywhere from 1 to 5 hours throughout the day crying. Understanding some of these causes may allow you to better handle your baby's fussy times. Here are some reasons why a newborn will cry.
One of the things that they like to do is to be swaddled, okay? And swaddling gives that feeling of them being still in mama's belly. And you're going to place the blankets in a safe area with the triangle flap right there, one of the corners flapped in. Line it with the baby's shoulder. Bring the baby's arm down. Tuck this side of the blanket right under the baby's back. Make sure it's pretty snug over, okay? Then you're going to grab the bottom of this flap, bring it over the baby's shoulder. Make sure you have a good grasp on the arm because they're going to want to get out of the swaddle, okay, and fight you. Then grab this side of the blanket, bring it over the baby's chest, put your hand right here, grab the bottom of the flap, and bring it right over the baby's chest. Then you can just bring this back of the blanket over. You can either tuck it in the back or just leave it at that. And then you just grab your baby, go ahead and pat him. They like to be swayed back and forth. And you see how quick he's calmed down?
Wow, that's amazing.
Newborn screening is a medical procedure which screens babies for serious disorders. The procedure should be performed when your baby is 24 to 48 hours old and requires a few drops of blood from the baby's heel. The sample is placed on a special filter paper. It is allowed to dry and then sent to a laboratory where many different screening tests are performed. These tests identify serious or life-threatening conditions, such as PKU, before symptoms begin. Although they are rare disorders, they can affect a baby's normal physical and mental development. Early diagnosis and proper treatment can make the difference between lifelong impairment and healthy development. It is estimated that 1 to 3 of every 1,000 babies born will have serious hearing loss. Hearing screening for newborns before they leave the hospital or maternity center is becoming a common practice. It is recommended that all newborns be screened for hearing. If hearing loss is not caught early on, then there will be a lack of stimulation of the brain's hearing center. This can delay speech and other development in your newborn. Hearing loss is the most common congenital disorder in newborns, 20 times more prevalent than PKU. Talk with your healthcare provider about the important screening tool. In newborn babies, a degree of jaundice is normal.
I noticed that his skin looks just a little bit yellow.
That's very, very common. Most of our babies turn a little bit yellow jaundice, and that's because the bilirubin goes high. That's why we want babies to take too much of the colostrum, because colostrum has a laxative effect, and it's going to clean the baby's system. But before you go home, the doctor is going to order a bilirubin test, and that's what is going to indicate if the baby needs further treatment.
In newborn babies, a degree of jaundice is normal. When red blood cells break down, bilirubin is formed. The baby's liver is too immature to properly get rid of the bilirubin and prepare it for excretion. Normal physiologic jaundice of the newborn typically appears between the 2nd and 5th days of life and clears with time. For high levels of bilirubin, phototherapy may be used. Since bilirubin absorbs light, jaundice and increased bilirubin levels usually decrease when the baby is exposed to special blue spectrum lights. Phototherapy may take several hours to begin working, and it is used throughout the day and night. The baby's position is changed to allow all of the skin to be exposed to the light. The baby's eyes must be protected and the temperature monitored during phototherapy. Blood levels of bilirubin are checked to monitor if the phototherapy is working. If you notice your baby's skin or eyes looking yellow, you should contact your child's healthcare provider right away. Regular medical checkups during the first 2 years of life can help keep your baby happy and healthy. Your baby will be scheduled for regular well baby exams in order to monitor his growth and development and allow you to talk about routine care with your baby's healthcare professional. These visits are most frequently scheduled with routine immunizations for many of the preventable childhood illnesses.
How often is he supposed to have his shots?
Well, he's due for some when he's 6 months old. Immunizations are so important. If there's one thing you can do to protect your child, it's immunizations. His are up to date up until this point, and he'll be getting his next ones at 6 months, his DPT, which is diphtheria, tetanus, pertussis. He'll also get a polio vaccine then, his Haemophilus influenza, his Prevnar, which is a pneumococcal vaccine, and hepatitis B, as well as rotavirus. That sounds like a lot, but we're fortunate these days that we have combination vaccines. Some of those vaccines can cause some side effects, such as fever or fussiness, but those are usually controlled by things like acetaminophen.
Even experienced parents may feel worried as they adjust to a new baby's habits, needs, and personality. It is important to remember that most of the common physical problems that occur during a given 24 hours with a baby are usually normal situations or problems with simple answers. But if any of the following symptoms of illness occur, a call to your baby's healthcare professional is in order. Blue lip color is a 911 call. Blue or pale colored skin. Yellow skin or eyes. Patches of white found in baby's mouth. Eating poorly or refusing to eat. No stool for 48 hours and less than 6 wet diapers a day. Redness, drainage, or foul odor coming from the umbilical cord. Does not urinate within 6 to 8 hours of circumcision. A temperature of 100 degrees Fahrenheit or more. Difficulty breathing. Repeated vomiting or several refused feedings in a row. Listlessness. Crying excessively with no known cause. An unusual or severe rash other than prickly heat. Frequent or successive bowel movements with excess fluid, mucus, or foul odor. Experiences drastic behavior changes such as increased irritability, excessive crying without a cause, extreme sleepiness, or floppy arms and legs. Congested cough, running eyes, or running nose. According to the American Academy of Pediatrics policy statement on breastfeeding, women who do not have health problems should exclusively breastfeed their infants for at least the first 6 months of life. They also suggest that women try to breastfeed for the first 12 months of life because of the benefits to both the mother and the baby.
I haven't seen any milk come out yet, but there's just a little bit of watery stuff.
That's the first milk, and you have just a small amount because that's all what your baby needs. This first milk is colostrum, we call it colostrum, and colostrum is rich in immunities for your baby, and that's exactly what he needs. Plus, it's a kind of a laxative, and that's what is going to help clean the baby's system. But even if you think that it's no milk coming out of your breast, it's there. But it's exactly what the baby needs the first couple, 2-3 days.
Before you go home, we want to talk about some breastfeeding positioning. Make sure that everything's going well, your baby's latching on correctly. Okay. So first of all, we're going to do the cross cradle hold. Okay. And it's always good to put a pillow.
Comfort is so important when you begin a feeding. Have pillows all around you and hold your baby close. Skin-to-skin contact will keep your baby warm, interested in breastfeeding, and afford you a wonderful bonding experience. Proper positioning and latch-on are the keys to successful breastfeeding. There are different positions to hold your baby while nursing. These different positions prevent placing the same pressure points on your nipples and help with more even breast draining throughout the day. It is important to know the different options for holding your baby for a feeding, because this will allow you to choose which works best for you and your baby. Have your nurse or lactation consultant review positions with you before you go home. Getting the baby to latch on correctly is one of the most important steps in successful breastfeeding. The baby must open his mouth wide enough to get a good amount of the areolar tissue into the mouth. If the baby latches onto just the nipple, you will become sore and the baby will get a limited supply of milk. It is the proper compression of the areolar tissue from the baby's suck along with the motion of the tongue that allows the milk to be drawn out through the nipple. It is important for you to know the proper signs of a good latch-on. When the baby is latched properly, you should see the pinks of the baby's lips. This tells you that the lips are turned outward rather than tucked tightly inward. There should be a tight seal between the baby's mouth and the areola. Much of the areola, at least 1 inch, should be inside the baby's mouth. As the baby is sucking, you should not see the base of your nipple, but only the outer part of your areola. Your baby's tongue is between the lower gum and your breast. If you pull down gently on the baby's lower lip, you should be able to see his tongue. With a good latch-on, baby's tongue extends over the lower gum, forming a trough around the nipple and cushioning pressure from the jaw. The tongue rhythmically milks the breast with a wave-like motion from front to back, drawing the milk from the areola and the nipple. As you see in this animation, the nipple is far back in the baby's mouth and not compressed by the gums, so it is less likely to get sore. If the baby latches onto just your nipple, as in this animation, your nipples will be sore after just 1 or 2 feedings, and your baby will not get enough milk. Eventually, you will know that your baby is latched on and sucking efficiently by the way it feels. There should be no pain. In no time, you will be assured that your baby has a solid and secure connection to your breast.
Good. Any times that you feel pain, there is a problem. Baby is just biting the nipple, so we need to break the suction and place the baby back in the breast. You want to breastfeed, not to nipple feed.
Hello, how you doing? Good. Good, well, it's time to breastfeed, okay?
Okay.
What we're going to do first is we're going to bring your gown down, and what we're going to do is have your baby skin to skin.
Research has shown that skin-to-skin babies breastfeed better and stay awake during the feeding. In addition, skin-to-skin babies have shown to breastfeed an average of 6 weeks longer. There are many reasons why skin-to-skin contact is vital for a baby's healthy growth and development.
It's good to wake them up when you're about to breastfeed. And the way to do that is by taking their hats off. They're sometimes changing their diaper to wake them up helps a lot, okay? Okay. So what we're going to do first is we're going to bring your gown down. And then we're going to put your baby's skin to skin. Right there. Is that good enough? Yes, that is great. And then you can always put a towel, a blanket right over your baby.
Okay.
The best start for breastfeeding is when a baby is kept skin to skin with the mother. The baby's sense of smell allows him to find the breast and to begin the initial latch-on. This is called self-attachment. Skin-to-skin contact does not have to be limited to the delivery room and hospital stay, but should be practiced frequently. Now experts agree and understand how important it is for a mother and her baby to be close to one another as early and for as long as possible in the first few weeks and months of life. In the early days, some babies are sleepy and do not often cry when they are hungry, so stay attentive to the cues. Watch for early feeding cues such as lip smacking, mouth opening, and hand to mouth. After the first sleepy week, crying is a late cue.
Should I wait until he cries to feed him?
No, you're gonna be watching your baby. The first sign that he's telling you, "Mommy, I'm hungry." If you see that the baby's moving, or you see his lips moving, you see his tongue, he's moving around, he's telling you, "Mommy, I'm hungry." By the time he cries, you wait too long. The first signs of "I'm hungry," you offer the breast.
Research has shown that babies, minutes after birth, begin to interact with their parents and give cues as to what they need and want. They are in a state of quiet alertness. Learning these hunger cues your baby gives is vital to help with brain growth and development, as well as helping new parents gain experience and feel comfortable in caring for and interacting with their new baby. The most common concern that you will have is if your baby is getting enough to eat. Unfortunately, there are no ounce markers on your breast for you to see the exact amounts he is taking in. This can be unnerving at times. There are many clues, though, that indicate that everything is going well.
Once I get home, how will I know that he's getting enough to eat?
Well, first thing, you had to make sure the baby eats from 8 to 12 times in 24 hours. And make sure the baby is really eating, not sleeping when you are feeding him. You're going to hear the baby swallowing. You're going to see that your breast is full, and once baby finish eating, your breast is going to feel soft. And it's very, very important for you to know that your baby is giving you wet diapers and poopy diapers. And before you go home, you're going to have a breastfeeding log. That way you have an idea what to expect every day from your baby. How many wet diapers and poopy diapers you're going to be changing every day.
How long should he eat?
When babies are very sleepy, at least 15 minutes. But then few days later, baby's gonna tell you when he's full, and he's just gonna let the breast go. He's gonna relax, and he's just...
So he's falling asleep.
Weight gain is also an important sign that your baby is getting enough to eat. There are many advantages to breastfeeding. However, formula feeding is an acceptable choice for some mothers. Your pediatrician or family care physician will start your baby on the formula that is right for him. To choose what formula is right for your baby, talk with your baby's healthcare provider. Once you've made a selection, choose the type that works best for you, whether it is powder, concentrated liquid, or ready to feed. Prepare your water and formula and clean supplies according to your healthcare provider's instructions. Watered-down formula is not recommended for baby's health. In order for a child to receive appropriate nutrition for normal growth and development, proper formula preparation and feeding is very important. Adding too much water to formula can significantly impact a child's nutrition because it dilutes essential nutrients in the formula, and results can be serious. When preparing formula, please follow the exact directions found on the packaging. Formula preparation can be easy. Just be sure you always follow these simple rules before you begin. Make sure you have plenty of bottles and nipples, as well as a bottle brush to clean all the bottle parts. Be certain that bottles and nipples are thoroughly cleaned and rinsed. Always check the expiration date. Never feed your baby formula that has expired, or use formula if the container is dented. Clean the lids of formula cans to remove any dust or soil. When using ready-to-feed or concentrated liquid, shake the formula containers before opening. If your formula is in a can, be sure your can opener is clean. Wash your hands thoroughly. Always test the temperature of the formula on yourself before feeding your baby. Never microwave formula. This could burn the baby's mouth. Microwaves heat unevenly, and there could be a hot spot in the formula. If you need to warm it for the baby, just place the filled bottle under warm running tap water to take the chill off. Hold your baby close to you and make eye contact. Never prop the bottle and leave your baby for any length of time. This could cause your baby to choke. If your baby does not finish the entire bottle, you must throw away whatever is left over. Bacteria will grow very quickly in the formula because saliva from the baby's mouth is transferred into the bottle during the feeding. need to have a car seat to take your newborn home. Hopefully, you will have already learned how to correctly install your car seat in your car. Have someone bring the car seat to your room the day before you are discharged so that you have time to adjust the straps correctly for baby if needed. This may also save Dad an extra trip home on the day of discharge to pick up a forgotten car seat.
Okay, I want to talk to you about a few things that are important for you to know about this harness. They need to be rear facing in the back seat, preferably the middle is the safest place as opposed to being one side or the other, left or right. The harness needs to be at or below the shoulders, okay? And you want your shoulder piece to be right at the level of the armpits, okay? And you want, once you get them snapped in, you want to not be able to pinch any webbing. All right, so you want it to be fairly snug, but not so snug that the child's uncomfortable and fussy. Mom, why don't you go ahead and put him in? And let's take a look.
The American Academy of Pediatrics recommends that children should ride in rear-facing child safety seats as long as possible. New research indicates infants are more than 5 times safer, according to the AAP, riding rear-facing in a convertible car safety seat until they reach the maximum height and weight recommendation for that particular model, or at least to the age of 2.
Okay, now pinch the webbing and take it, see if that's tight enough. That looks good. And we have the chest piece at the armpit. That looks great.
SIDS stands for Sudden Infant Death Syndrome. It's the unexpected death of an infant less than a year old. It can be prevented by placing an infant on their back to sleep, either at night or in nap time.
Shaking a baby even slightly is very dangerous. It causes a serious problem known as shaken baby syndrome. This can lead to major brain damage and death. When a baby won't stop crying, it can be frustrating. The stress of caring for a baby, especially if your baby has been sick, puts a strain on parents. But no matter how fed up, tired, or upset you are, you should never shake your baby. When a baby is shaken, the brain moves back and forth. Even a little force could cause the brain to hit the inside of the skull. This can result in bleeding and swelling of the brain. It can lead to permanent brain damage, coma, or death.
Becoming a parent can be a very joyful experience, but often when your infant is tired or crying a great deal or is ill, we can become tired and frustrated. During those times, shaking your baby can be a very dangerous event and can cause a problem called shaken baby syndrome, in which their brain can become injured. If you're ever in the circumstance where you feel tired and frustrated, try to find another adult to help. This can prevent shaken baby syndrome.
Welcoming a new baby is exciting for your family. But before you bring your baby home from the hospital, have your partner or friend take home something with the baby's scent, like the baby's blanket for your pet to smell and study. When you return from the hospital, your pet may be eager to greet you and receive your attention. Have someone else take the baby into another room while you give your pet a warm but calm welcome. Always supervise any interaction your pet has with the baby. You want your pet to view associating with the baby as a positive experience, so praise for appropriate behavior is important. No doubt life will be hectic the first few weeks at home. Try to maintain regular routines as much as possible to help your pet adjust. And be sure to spend one-on-one quality time with your pet each day. It may help relax you, too. With proper training, supervision, and adjustments, you, your new baby, and your pet should be able to live together safely and happily.
Oh, it's definitely brought us together. When we come to the ICU to feed her, I'll hold her or she'll hold her and we'll just talk to her. I feel stress-free when I leave the ICU, and then we're walking down the hallway, our arms around each other.
She's really brought us closer and to be a family, and she's made us a lot happier.
Each baby is unique. A great deal of how you nurture and love your child will come naturally. Parenting is a process that requires you to constantly learn. You will discover new skills and insights along the way that will allow you to learn what works for you, your baby, and your family. You will realize very quickly that parenting is one of the most defining and rewarding responsibilities that outweighs any of life's challenges you may face in the future.
I think initially, bringing home that new baby, it was helpful for our relationship. It brought us together. We're going through this new, great, horrible experience together, and so it definitely brought us together. But as the child gets older, and more time is focused on that child, and that novelty wears off. So it's definitely, kind of adds to a strain in a relationship because there's not as much time to focus on each other. So it's important to, have someone come over so you guys can at least go out to lunch or do small things together where you're still trying to kind of keep what you love about each other, keep that moving forward and keep that candle burning, so to speak.
When it comes to raising a child, it is amazing how fast the time flies. Embrace every moment, and yes, even the tough times, because you will never get those moments back. More than ever, communication with your partner is crucial. Together, you can choose what is best for your child. At the end of the day, it comes down to love. Your love for this precious life will guide you in making the right decisions. Your protective instincts come naturally. You have everything you need within you to be the best nurturer and parent. Take pleasure in parenthood and enjoy your journey.